Hello, Susan Connersing from Dawning Visions Hypnosis here to speak to you about mental health therapy. Maybe you're a person who takes many of these things personally, or maybe you're a person who cannot leave your client's problems in the office. Therefore, invading your personal life with all of the problems of your patients. This is a really huge problem for some people, and it really does lead some of them to getting pretty ill because it's very stressful on the mind and the body to constantly be in this anxious, upset, emotional place. So how do you deal with it? You deal with it by understanding that your patient's problems are their problems. They're not your problems. They're their problems. And the responsibility for the healing is on your patient. To the degree that they are willing to do the work required during the therapy sessions is the degree to which they will be able to be healed. That doesn't mean that all sessions are easy to get through. Sometimes they can be quite frustrating. And still, you need to hold the place and the space for your patients to do their healing work. You need to realize that this is your profession. It is not your life. You need to make the differentiation. And recognize the fact that it's really important to have the people in your life supporting you and loving you up. So that when you're out with your friends and out with your family, you're not listening to their problems, they're not asking you for diagnosis or ideas on medication, all the rest of the stuff. I know I was there many, many moons ago, and I stopped it when I got into hypnosis. Because the reality of the situation is that I'm not here to diagnose anyone or look up medications for anyone, unless they are my paying client. Those are the only people. So, we need to be able to separate our work life and our personal life and know that we can have fun with the people in our personal life. To know that we can have our vessel filled by the people in our personal life. It is so important. I make it really clear that anyone who needs so much of my time that it feels like a client situation instead of a friend situation, they best to go get some help. Because frankly, I'm not there to do that. I'm there to be their friend. Yes, I will help people if they're having a hard time, if it's something that I'm seeing and I can do a quick intervention for them, if they want to do it. And I've done it for several of my family and my friends over the years, usually free. Not always, but it really depends on the amount of work that needs to be done. If it's just a quick something or other, it's nothing I have to charge for. I do it as a friend, because I always figure that if I can do it for my clients, I need to be able to help my friends and family in the same way. Now, some people feel that that is totally undoable, and it's got a lot of problems, and I'm going to tell you right here, right now, the people for whom I helped are really glad I helped them out, all right? So, enough said on that one. I am not a licensed professional. I am a hypnotist and neuro-linguistic programmer, and I can use my own sensibilities in terms of how I provide my services and to whom I provide those services and at what charge. So I would like you to consider what you need to do to take better care of yourself so that you're not bringing home your problems, or more significantly, the problems of your patients, because that is not part of your job. Your job is to be present with them and help them learn how to have better coping mechanisms, give them some tools and techniques so they can deal with their life in a much more productive and healthier manner. And that's it. That's your job. It's okay to care about your patients, and I would hope you would, but there is that boundary that needs to be placed there. If you're having a hard time doing that, maybe you should get some help yourself. And I do offer services to mental health professionals and others who are having a really hard time drawing appropriate boundaries in their lives. And those who have traumas that are still not healed using hypnotism and neuro-linguistic programming. If you're interested in those services, I'll leave my contact information below so that we can set up a time to have a free consultation call to see if that's something you'd like to consider. Because we can only help the people we work with heal to the degree that we are healed ourselves and do not have these problems in our lives. Yes, I know that we do have issues that come up and we need to continuously work on ourselves to resolve them. But I'm talking about the major problems that people have that they have still not cleared out of their lives. It is impossible to give therapy to people when you have not cleared your own issues in those particular areas. These are the things that trigger some people. If you're feeling triggered, that means that you need to get help to be able to clear those problems so you're no longer triggered by your patients when they tell the stories that would trigger you because their story is too close to a negative event that you experienced yourself. I also offer a 2-day VIP training to help you to integrate hypnotism and neuro-linguistic programming into your practice. It's a fun process. It's fascinating, and my trainees love it. I include the 12-month mentorship because, as you know, going through therapy training, that you had to do a clinical where you had supervision and you were able to get input from your supervisor in terms of how to handle the more challenging cases. Same thing here. My mission is to train as many mental health professionals in integrating hypnotism and neuro-linguistic programming into their work so that it can not merely manage symptoms of their patients, but help their patients to actually heal and move on with their lives, because everybody deserves that. The only people that we really can help with hypnotism and neuro-linguistic programming would be those who have diagnosed by a professional personality disorders, people with an IQ under 70. We do work really well with kids. Kids are amazing hypnotic subjects because they're already in it. And those with psychotic features. Otherwise, pretty much anyone else can be helped with this work. So again, if you're interested in that, I will leave my contact information in the description box below. As always, I thank you for spending your time with me. Till next time, bye-bye all.